Snoring is loud, harsh breathing when you sleep, and sleep apnea is when breathing intermittently stops during sleep. The two conditions are not always directly linked, but often occur together. With sleep apnea, the tongue and uvula relax and fall back, obstructing the airway, making breathing labored and noisy. Someone with obstructive sleep apnea may stop breathing for 10 seconds or more many times each night, resulting in daytime sleepiness and potentially other associated health problems. A successful method in managing mild to moderate obstructive sleep apnea and snoring is the use of an oral appliance. Similar to an orthodontic retainer, this custom-fitted plastic appliance is worn in the mouth during sleep to prevent the soft throat tissues from obstructing the airway by positioning the lower jaw slightly forward. They are especially convenient for people who travel frequently, who go to remote areas without electricity, thereby unable to use a CPAP machine, or who needs to use something during the allergy season when their nose may be blocked.